Welcome to H&HN Daily's video interview series. I'm Hayden Bush, online editor for Hospitals and Health Networks magazine, and I'm here today with Steve Lieber, President and CEO of HIMSS, for a preview of HIMSS11 and a look at some of the hot topics in health IT these days. Steve, thanks for joining me today.
Glad to be here. It's my pleasure.
Well, Steve, things must be pretty busy for you. HIMSS11 is coming up next week.
Yep.
What do you see as the big hot topics and issues that folks are going to be talking around the exhibit hall next week?
Well, Hayden, the big issue, which really goes back a year or more, has been the federal regulations around meaningful use. You step back to early 2009, you had the passage of the legislation. Finally, in the summer of 2010, we get the regulations, and from July of past year till now, everybody has known the roadmap, know what they need to do in order to meet the requirements for meaningful use, which therefore translates into significant funding. And so the primary theme, the primary discussion topics are going to be around the definitions of meaningful use, the specific regulations, what I've done to get my organization there, what barriers I've run into along the way, the staffing challenges that I have in order to accomplish those types of outcomes in terms of adoption, bringing in new versions of software, that sort of thing. So that's really going to be the primary topic.
And along those lines, what's the sense you get from the field in terms of where folks are with their compliance?
Good progress, very good progress. I mean, let's start out recognizing that the federal government didn't set the bar too high. There are political balances that had to be realized in this first round of regulations. You set it too high and people get frustrated. They don't think that they have any reasonable chance of realizing those expectations, and that would put a very negative sort of aura onto the field. And so the bar wasn't all that high to begin with, substantially above where we were, but still not out of reach. And so our expectation is that over the first 2-year period, because you have 2 years to certify that you and demonstrate your meaningful use in order to qualify for the full level of funding, that the estimate in the hospital marketplace is easily in the 60 to 70% range that will be able to demonstrate meaningful use and qualify for the full first couple of years of funding.
And along those lines, looking at a lot of the hospitals who are maybe purchasing EHRs for the first time, one of the things we're hearing from the field is that there's some concern that not all IT vendors are in a position right now to offer the guidance and the support that some of those smaller hospitals really need. And I'm interested just in your perspective on vendor readiness and kind of where you see that evolving.
I think that one of the things we've got to be careful about is watching the gold rush that seems to be happening in healthcare technology right now. It's a field that a lot of companies recognize having a great deal of market potential, and as a result, there's the possibility that there are some products that will attempt to come to market that aren't ready. I think overall, you look at the traditional healthcare IT vendor community, they've been preparing for this day for a number of years. I mean, like at HIMSS, we started talking about the issues of interoperability and certification 3-4 years before the regulations ever came into place. Vendor community that was already in healthcare technology were very much a part of those discussions. We had the voluntary certification program that predated anything that we see today, and that drove a lot of behavior, both on the buyer side of we're looking for certified products, even though it was a voluntary certification, and it drove the vendor community of let's make sure we build our products in line with that voluntary certification. Well, all of that work laid a tremendous foundation for the current level of regulations. And so vendor readiness is very high among those who have been part of the game for a few years.
Okay. Well, Steve, switching gears a little bit, another one of the big areas where health IT is evolving right now is with all the new kind of accountable care organizations and other partnerships with providers that hospitals are getting into. How do you see the role of health IT departments evolving as hospitals are more focused on coordinating with doctors and with other providers in the community?
Well, the concept of accountable care is a significant shift in a variety of ways. It's a significant shift in the clinical delivery of care. It's a significant shift in the reimbursement of care, and it's a significant shift in the technology needed to support that care. The exchange of data is absolutely critical as you are accountable for a continuum of care that may occur over multiple settings. And so the ability to move data from place to place, following the patient around, the ability to use data in order to monitor and assess outcomes, and in fact use data to drive changes in behavior that'll change outcomes. It is a significant, the concept of accountable care is just a significant shift in the way an organization thinks about healthcare, and technology is just one of those key cornerstones, because you simply can't achieve that without the high degree of intelligence and analytics that must be done as it relates to populations of patients as well as individual patients.
Okay. Well, Steve, we've touched on some of the issues I wanted to ask you about today, but I just wanted to give you a chance if there's anything else at HIMSS11 or anything else just in terms of health IT that you wanted to talk about.
Well, I think there are a couple of things that I'd like to highlight. One of them is a move that we're seeing across healthcare technology into what we'll call non-traditional devices and technologies, move towards mobile applications and mobile instruments. That very much is a part of what we're trying to bring into the HIMSS conference. Historically, the HIMSS conference has been absolutely the place to go to look for existing technology that is very prevalent in the marketplace. In our HitX.0 conference, that is a conference within the broader annual conference, we're focusing on these new technologies, the new hardware, new software that are being brought in, the recognition that the delivery of care doesn't always occur just at the examining table or the bedside, the ability of patients to move, practitioners to move, the use of tablets, the use of different applications that allow physicians to monitor patients from the physician's home, let alone from the patient's home.
Right.
All of these are workflow changes that are occurring within healthcare that we want to make sure that the people who attend the HIMSS conference have the opportunity to see, to hear about, to learn from, see companies demonstrate the capabilities of those types of products. So that very much is a new component, one we haven't really touched on here, that's a part of what we're going to be seeing next week.
Well, it should be a pretty exciting conference.
We believe so.
Well, Steve, that's all the time we have for today. Thanks for coming on.
Great. Thank you very much, Hayden.
Thanks.